Hello, everyone, and welcome to another conversation here at the podcast in Harm Reduction International Conference in Bogota 2025. And I would like to welcome Abigail Sprakes, who is an assistant professor at Lakehead University in Thunder Bay, Ontario. Abigail, welcome to the podcast.
Thank you, David. It's fantastic to be here. Really excited to chat with you.
Perfect. So tell us, Abigail, a little bit about your recent work in the field of harm reduction.
Yeah, no, thanks for asking and providing the platform. It's always great as a researcher to be able to talk about what you're doing, to have someone interested. So the work that I've been doing over the last number of years has been working with individuals who are part of a safer supply program. And what that is a program where individuals who are using drugs that they've purchased from the street that have a high level of toxicity that could lead to harm such as an overdose or a fatal overdose, that a safer supply program actually provides a safer prescription of opioids so that they're not actually having that toxic drug in their system and then potentially overdosing. And so the work has really been focused there from a harm reduction perspective around how do we ensure that people stay alive, that they have the rights to basic human rights around their own health care and substance use health?
So, can you tell me what are some of the most urgent services people seek out to when receiving support?
Yeah, I mean, the most urgent, of course, is to stay alive. And so typically what would bring someone to a safer supply program is the desire to not have the toxic, unregulated street drug. And so when they're coming to service, really it's, I don't want to go through withdrawals. They're excruciating. I don't want to die. I want to be alive, but I don't know how to do that necessarily. So they're coming looking for, again, that safer prescription. But then on top of that, they're really looking for some support around their own physical health needs. So primary care, wound care, sometimes care for HIV or Hep C that has been untreated. And so really looking to get some health care around primary physical care. But then also people, as you know, I mean, are having a really hard time. They're struggling, right? They're in survival mode, and they're really looking for opportunities to connect with people to talk. And so the other service often is mental health support. And then there's some other underlying services just around looking for housing. A lot of people that don't have housing or even safe housing, even if they are housed. So maybe living in encampments that are, again, under increasing surveillance in communities and police presence and needing a safe place to live. And so those tend to be the core programs or services that people are looking for. Healthcare, housing, those are the key areas.
So, Professor Abigail, I think I'm going to play some devil's advocate here.
Okay.
I'm a Canadian citizen who doesn't know
Yes.
anything about harm reduction.
Yeah.
And all of a sudden I say, Abigail, you're just replacing one drug with another, or you're enabling these people to use drugs.
Oh.
What would you answer?
Yeah, well, I love these conversations because it gets to invite, some diverse opinions around this topic. But I mean, I would simply say I'm absolutely trading one drug for another because I don't want people using toxic drugs that kill people. That are killing people at astronomical numbers. In our community, it's killing more people than COVID-19 did. And it's not to do a comparator, it's just to highlight the issue that this is a public health issue that isn't being addressed. And I suppose, the drug you're replacing it with is a drug that will not kill the person. It is allowing the person to stay alive. So I'm not going to get into an argument with someone about that. I'm going to say absolutely, and that's a good thing. I think when it comes to enabling, I think that's, again, an old argument that I don't spend a lot of time with. I'm more curious around people's perception of what that means.
Yeah.
And when you have a conversation about what it means for people to get access to healthcare, that kind of shifts people's perspective around, if I have the right to healthcare and if I'm a person who uses drugs, I should be able to get the healthcare that I need.
Okay.
The other argument that comes up, I think, from time to time is a cost issue. So, I'm the taxpayer and I'm just, I'm going to use the language, not my language, but I'm just going to pay for a drug addict to get their drugs. And so, you hear that out there in the narrative. And I think that is just a bit of a misnomer to have that conversation. So I try to, stay away from that. But if someone wants to have a cost effectiveness argument with me, I'll say, absolutely. Let's look at, the stats. We know that if we provide appropriate care at the right time, and in this case with the right dose, so that people do feel like they have some mastery back in their life, some control, that you're not going to have people going to the emergency department. You're not going to have people incarcerated and in conflict with the law. You're going to have people that are able to make decisions for their own life and not kind of be impacting systems like healthcare and the justice system. So I think that argument doesn't hold a lot of water around enabling. And so thanks for the question. But I think it's a conversation, right?
Yeah.
It's okay to have different opinions. But when we have opinions about what's right for someone else's life, that's not a conversation I'm necessarily going to engage in. I'll hear it, but really, that's not an argument that I'm going to engage with anytime soon.
Perfect. Good answer. I was also going to ask you, why is social connection so relevant for people? And at the same time, we oftentimes see academics getting involved in the field, physicians, nurses, and whatnot. But what about the relevance of incorporating people's voices in their recovery or in their participation? Why are their voices so relevant in the design of these policies or activities?
Yeah. Well, we can't talk about people without including them. And we can't start asking questions without asking people, what do you want to talk about first? And how can I ask you the question that you're most comfortable with? And so you had two questions, one about the social connection, but then I think the piece around inclusion, and maybe I'll start with the inclusion. As a community-based researcher, I'm never going to do a research project that does not have people with living experience as part of the co-design, the ideas. Because really with research, we're trying to come up with ideas, at least in this circumstance, for people to have better health outcomes. And who is the expert in that? The person who is using drugs.
The person in front of us.
I'm a conduit, right?
Sure.
I'm passionate, I'm an ally. I want to make sure that their voices are heard, but that voice won't be appropriate, accurate if I'm not engaging people with living experience and people who use drugs within that research design. So it's just an imperative, and I don't partner with other researchers that won't include people with living experience. It's just sort of a no-go. So, but the social connection piece, to come back to that, the current research that I'm doing related to the Safer Supply program, we looked at program outcomes more from a programmatic perspective. Are you meeting all of the targets? And looking at social determinants of health came out of that. But this piece that sometimes gets missed in the conversation, that I think is harm reductionist, we know this, but social connection is the key. And so even when I think about something like Safer Supply, and I said this in my presentation earlier, is that the Safer Supply helps keep people alive, but the connection with people allows people to be alive.
Whoa. Can you say that again, please?
Yeah, so the drug itself helps keep people alive, but the connection that they have within these programs helps them to be alive.
That's powerful.
It's hugely powerful, and we have to get past just survival, right? It's survival and quality of life. Those things are an and, it's not an either or. And so do we, want to make sure people stay alive? Absolutely. That's what Safer Supply is about, but it has to be more, right? It has to be more. And we want to think about how do we add this notion of social connection into the social determinants of health. Many researchers, not just me, have talked about this issue, that the social piece is critical. You cannot have health outcomes that allow people to live healthy lives without social connection.
For sure.
Right? And stigma is the thing that's getting in the way of that. So stigma needs to be addressed as a social determinant of health. It has to be on there, and it's not.
It's so relevant what you're saying, because as a psychotherapist myself, I just see how stigma is such a huge barrier in all settings. The research, therapy, groundwork, anything in the harm reduction world is hampered by stigma. So there is a huge challenge in that.
Yes.
Can you please provide us just a bit more info about how you combat stigma in Canada?
Yeah, so that's a big question. Maybe I'll talk about how we're trying to combat stigma within the research I'm currently involved with.
Sure.
And so part of it is trying to give a face and give a name to the statistics, to be able to have people share their experiences, their lived experiences that perhaps you don't see necessarily in a report, right? As you read a report, the numbers all kind of blend together and you go, yes, this is an issue. But we're trying to combat stigma by saying, like, listen to the stories. Again, social connection, talk to people. We've just done a phase 3 of the study around digital stories, having people tell their own stories and having the bravery to say, listen to my story and put it out there. It's incredible work. And so I think the more and more we talk to one another, and I know that sounds
cliche.
Yeah, but it's so true.
It is.
We have to listen to one another. We have to talk to one another.
Right.
And I think we see this where I'm from is that the evidence is not being listened to. The evidence is there that harm reduction works, that safer supply programs work, and yet government is saying we're not going to fund this even more in the face of evidence. And so if evidence isn't the thing, what's the thing?
Right.
So the thing has to be about understanding people's experiences and relationships and connecting and letting me, tell you my story. And I did this in the presentation briefly this afternoon to say, I'm a researcher. That's what I do. But I've lost a loved one to a fentanyl overdose.
Yeah.
And that's what people talked to me about after the presentation. It wasn't like those were great stats. It was, I've been touched by this too.
Yeah.
I'm really sorry you've had that experience. I'm sorry that, you've lost this really important, incredible person in your life.
Right. So even if you have the evidence as a number, it is different when they actually hear a story.
Yes. And so the more we can do that and get into spaces where we can have conversations where people disagree with us, where people say, this is enabling. I want to be invited to those spaces because I want the stories. We're all storytellers. I want those stories to get into those spaces where people disagree with every single piece of research I've done. Because that's how we combat stigma.
Sure.
Right? I'm not combating stigma talking to my colleague that does this work too. We can support each other because it's hard to do this work alone.
Yeah.
But I need to be in those spaces where people think, no, your research isn't that good. Invite me, please.
So speaking on behalf of social connections, bonds, feeling safe, feeling not judged, can you just please share a message that you take away from Harm Reduction International Conference in Colombia? What do you want to say to our audience out there, to the people, to people who use drugs, mental health providers, whatever it is? Is there a message that you want to share?
Well, I think the message for people who use drugs who feel alone is to say there's a community out here. And so I may not never meet you, but I really care about your life. And I really want you to have access to your human rights, to health care, and that's critical. And that's really the work that I do, is around making sure that that message is out there. And I think from, again, just the harm reduction and being part of this conference, it's powerful. There are 1,200 people here that care about you, that care about what happens to you in your life, that care about what governments are doing that are not allowing you to have your basic human rights, and that we're not going to stop talking about this. And I think that's my role as a researcher, as a community-based researcher, to say, my role here is to amplify your voice. I'm a conduit for that. I'm not pretending that this is my experience, right? The people I work with, this is your experience, and that we have to, hopefully, can be seen as an ally that can do that, that maybe can get into spaces that not everyone can, right? And to have these conversations. And I think, that's a big part of the message is you're not alone, I'm not alone, we're not gonna stop talking about this. It's dangerous times, but we're gonna keep amplifying this issue and your voice, and that your life matters.
Abigail, thank you so much for the interview. We'll keep on spreading the message and make sure people hear it out there in the back.
Yeah,
Thank you so much for being with us.
This was fantastic. Thank you so much.
Thank you.